What if your body was quietly fighting inflammation and you had no clue? Most of us, even my friend here included, thinks of endometriosis as these painful, heavy periods, and it affects all our bowel and our gynecological bits. But that's not the case. We now know that endometriosis is a whole body inflammatory condition which is lifelong, and it's not always related to heavy periods. 1 in 4 people with endometriosis feel no pain whatsoever, and that's called silent endometriosis. Silent endometriosis is when cells similar to the lining of the womb are deposited outside in the pelvis, and they grow on your ovary or your tubes or in your pelvis as well, without all the obvious red flag symptoms that we talk about. So that heaviness, that painfulness, that irregular periods. And some only find out that they've got silent endometriosis or they have endometriosis, and I don't think it's actually silent, is when we're investigating for something else. So we do a scan that picks up either a chocolate cyst, which is known as an endometrioma, or if you're trying for a baby and you're struggling to fall pregnant, or if we're in there doing surgery for something else and we actually find adhesions and scar tissues and endometriomas, and we're like, oh, actually this patient that was having symptoms, and we might not even put all the dots together, actually what she had was endometriosis. Studies actually suggest around 20 to 25% of people with endometriosis have no clear symptoms, which means that because they're so vague, it can quietly affect your fertility or cause inflammation for years without anyone joining up the dots. If you notice something like you're getting bloating and everyone just calls that as normal PMS, or the fact that you're getting a metallic taste in your mouth, or you're getting fatigue, that heaviness, that bone deep exhaustion that doesn't go away, or your gut is always affected, or maybe even urinary symptoms, or you're getting heavy periods and you've been always told that actually this is normal and you can put up with it, none of that should just be put up with or shrugged off. We should always be thinking and investigating. And if I can say this, you are not being dramatic for wondering if there's more going on. A lot of people with endo have been minimizing their symptoms for so long and they're never taken seriously. And that's because there's so much gaslighting when it comes to endometriosis, because we don't really have a proper test for it either. So I don't believe that silent endometriosis is a thing. I think ignoring the signs and symptoms or even considering endometriosis is. So if your periods, your bowel, your bladder or bloating, or the fact that you just feel off and exhausted all the time, even if it's not excruciating, please speak to a GP or a women's health specialist or a gynecologist and mention endometriosis specifically. Like just say, could this be endometriosis? So save this before your next appointment, share this with your friend who might be being dismissed, and follow for more evidence-based information.